Low blood pressure, also known as hypotension, happens when your blood pressure drops below the normal range. Sometimes that's just how your body works. It doesn't cause any problems, and you might not even notice it. But other times it can be a sign that something else is going on inside your body. In this video, we'll go over what to watch out for with low blood pressure and how to manage it if it starts getting in the way of your daily life. Now, there's no exact number that defines low blood pressure, but most doctors consider it to be a systolic reading below 90 and a diastolic below 60. Most of the time it doesn't cause any symptoms, so it's hard to know how many people actually have it. But when symptoms do show up, it can become a real problem. You might feel dizzy, have blurry vision, feel tired, struggle to concentrate, get dehydrated, or notice cold, clammy skin. And when those symptoms happen, along with low blood pressure, they can lead to serious health issues, like kidney failure, stroke, or even a heart attack. If that's the case, your doctor will likely recommend some kind of treatment. The first step in treating low blood pressure often starts with your diet. Whether your blood pressure is high or low, what you eat can have a big impact on your numbers. In some cases, a nutritionist might suggest adding a bit more salt to your meals, because salt can help raise blood pressure. But don't get too excited. This doesn't mean you should load up on junk food. The increase in sodium is usually small, controlled, and done in a healthier way. You might also be advised to eat smaller meals more often throughout the day. That can help keep your blood pressure from suddenly dropping after you eat. And drinking more fluids can really make a difference, especially if you have a glass of water before a meal. In fact, a study published in the journal Neurology found that drinking about 16 ounces of water right before eating helped raise blood pressure and reduce symptoms, especially in older adults with orthostatic hypotension. Next, pay attention to how you move, especially when changing positions. The Mayo Clinic recommends taking it slow when you go from lying down or squatting to standing. They even suggest sitting on the edge of your bed for a minute and taking a few deep breaths before you stand up. This gives your blood pressure time to catch up and helps you avoid that dizzy, lightheaded feeling. Compression stockings are also commonly recommended for managing low blood pressure. According to the Mayo Clinic and Cleveland Clinic, they gently squeeze your legs to keep blood from pooling, which helps push it back toward your heart and maintain more stable blood pressure, especially when standing up. In some cases, low blood pressure might be caused by the medications you're already taking, like those for heart conditions, depression, or Parkinson's disease. According to the Mayo Clinic, your doctor may adjust your dosage or switch you to a different medication if it's contributing to your low blood pressure. And when lifestyle changes aren't enough, doctors may prescribe medications specifically to treat low blood pressure. One example is fludrocortisone, which works by helping your body retain sodium and increase blood volume. This can raise your blood pressure and reduce dizziness. Another is midodrine, also known by the brand name Orvatin. The Cleveland Clinic explains that it helps by tightening your blood vessels, which prevents your pressure from dropping when you stand up, especially in people with orthostatic hypotension. Now let's talk about alcohol, because it can actually make low blood pressure worse. Here's why. It acts as a diuretic, meaning it makes you urinate more and lose fluids. That leads to dehydration, which lowers your blood volume, and that can cause your blood pressure to drop even more. The Mayo Clinic even lists dehydration as a common cause of orthostatic hypotension. According to a study published in Circulation by the American Heart Association, alcohol can interfere with your body's ability to tighten blood vessels when you stand, causing your blood pressure to drop even more and making you feel dizzy or even faint. Checking your blood pressure at home is a simple but really important step in managing low blood pressure. Keep a log of your readings and jot down any symptoms you notice, especially when they happen. This kind of info gives your doctor a much clearer picture of what's going on and helps them come up with the best treatment plan for you. In fact, the Mayo Clinic recommends checking your blood pressure both while sitting and standing to catch any sudden drops, especially those linked to something like orthostatic hypotension. Don't miss the next video, 11 Common Causes of Low Blood Pressure. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.